you need a better definition if you're going to do anything. And if your definition is does semi-automatic rifle bans result in reduction in homicide, the answer is no. Thank you for letting me present my research regarding Canadian firearms legislation and its association with homicide, spousal homicide, mass homicide, and suicide in Canada. I'm assistant clinical professor of medicine and emergency physician in Ontario. I serve as an academic peer reviewer in the areas of firearm control, homicide, suicide, violence, and gang deterrence for academic journals, and have 4 peer-reviewed publications on legislation and the effects of homicide and suicide in Canada. In 2022, I presented and submitted my studies and a report regarding C-21 to the committee. The research demonstrated previous bans in the 1990s of a large number of handguns had no effect on homicide rates. Currently, a definition of assault rifles and subsequent bans has been proposed. My research on previous Canadian legislation is applicable in answering the question of what the effects of this legislation may be. Since 2003, the number of owned restricted firearms has doubled from 572,000 to 1.2 million. However, the rate of overall firearms homicide has not increased, nor has the rate of homicide by handguns. There's been recent fluctuations similar to the levels in the early 2000s, but the rate of homicide has actually fluctuated about a steady mean when statistical analysis is performed. In the 1990s, legislation prohibited over 550,000 firearms, including military-style firearms and handguns. However, my studies have demonstrated there was no statistically significant benefit on homicide, spousal homicide, or mass homicide rates in Canada. Restrictions of magazine capacity in 1994 was not associated with decreases in homicide or mass homicide rates. Prohibition of full automatic firearms in the late 1970s was also not associated with decreases in homicide or mass homicide rates. Other jurisdictions, such as Australia and England, have also applied significant controls to handguns and semi-automatic rifles, and no statistically significant changes in homicide rates were detected in multiple studies. Studies from the United States examining assault weapon bans have also revealed no significant benefit. Blau et al. And Siegel et al. Found that these legislations were not associated with a decrease in victims. Interestingly, when looking at 30 years of incidents, Blau found that shotguns were more associated with an increase in victims than semi-automatic rifles. Webster et al., using similar quasi-experimental methodology as myself, did not find an association between assault weapon bans and mass homicide incidents or deaths. Public mass homicide incidents or deaths. In summary, the evidence so far demonstrates that the proposed handgun and semi-automatic rifle bans will have no associated reduction in homicide rates or mass homicide rates. Methods that have been shown to be more effective in reducing firearms homicides involves targeting the demand side of the firearms prevalence in criminal activity. As demonstrated by StatsCan, a significant percentage of firearms homicide involves gang violence. To reduce violence that is currently occurring in Canada's cities, the evidence suggests that you need to act early to reduce youth gang involvement. A research report by Public Safety Canada in 2012 gathered evidence from programs operating in Canada to reduce the gang participation rate and demonstrated beneficial effects in the ranges of a 50% reduction in participation. Targeting legal firearms owners who rarely commit crimes with new legislation already shown to have no significant statistical benefit will not change Canada's death rates by firearms. The likely billions of dollars forecasted to be spent on confiscating firearms would be better spent on youth diversion and gang reduction programs. Thank you.
Here, but Dr. Langmann, your resume is quite extensive, and I know you're a very humble person, but I would like to highlight some of it. You have a PhD in biochemistry and molecular biology. You received your MD from Queen's University. You are a specialty emergency medical doctor at McMaster University. You received your specialty of emergency medicine at McMaster. You were also a fellow at the Royal College of Physicians in Canada. You were the chief trauma fellow in 2011. You are currently an ER doctor at St. Joseph's. You are also assistant clinical professor of medicine at McMaster University and the director of clinical teaching unit at St. Joseph's Hospital. I could go on, but that was just some of the highlights. You've also studied a number of peer-reviewed papers, and you are certainly one of the foremost experts in Canada from the research that I've been able to do on the issue of gun violence in terms of homicide, domestic homicide, and mass homicide, and the impact, if any, of various governments' gun control legislation. Is that very in brief a summary of your qualifications and the research that you do?
Yes.
Okay. I have, and I've reviewed your papers, and it would seem that, just to conclude, as you mentioned in your opening, that the gun control measures brought forward in the last number of years by this government and other governments have had no impact on homicide, domestic homicide, or mass homicide. Can you confirm that?
That's correct.
And again, your research is heavily peer-reviewed, and you've also been asked yourself by various medical journals to review other research papers in a similar field. Is that correct?
That's correct.
Okay, so just again, you have found no statistical significant beneficial association between firearms legislation and homicide by firearm, as well as spousal homicide by firearm, and as well as the criminal charge of discharge of firearm with intent. Is that correct?
That's correct. In this country. Canada.
In this country.
Yes.
Thank you. And your conclusions are based on sound statistical analysis, specifically, in particular, from the Government of Canada. Is that correct?
Yes, I use a lot of the Statistics Canada data. However, my studies have been peer-reviewed. They've also appeared in review articles, including in a recent Canadian Medical Association journal article, and rated the highest evidence that was available for examining this issue.
Very strict evidentiary standard with very high scientific analysis. Understood. And your latest peer-reviewed study went up to include statistical data from up to 2022, including 2022. Is that correct?
That's correct.
Okay. I do appreciate you coming very much. I know others will have questions for you as well, but as we all agree, it's important to make evidence-based decisions, so we appreciate you bringing this evidence to the forefront once again at our committee.
Dr. Langmann, I would like to start with you. You have stated that even with the increase in firearms, it was the rate of homicides, suicides did not change between 2003 and the last year of the study, right?
Yeah, so there's been no overall, so there's a fluctuation that occurs, but statistically there isn't an increase associated with an increase in the rates of firearm ownership. Okay.
Have you been, as part of your study or as part of your work in analyzing other countries, you referenced Australia and England, Madame Michaud has just referenced New Zealand. Have you also done analysis in terms of untraceable or the rise of untraceable ghost guns, firearms that are not we're not able to register or trace them? Has that been part of the study work that you have done?
So all firearm homicides are included in the research. Unfortunately, Statistics Canada doesn't label guns as ghost guns. They'll label them as other at times. Sometimes if it's difficult to identify, or they just were not identified in the report. So currently there's no real record of specifically ghost gun homicides or ghost guns used in crimes.
Statistics Canada treats ghost guns as kind of a ghost in terms of the statistical follow-up.
It's a new era. It's a new thing that we're starting to see, right? So they're going to have to catch up with their methods, and so will the police services that report these to Statistics Canada.
I mean, anecdotally, in terms of the news, we've in the United States, I understand there's been 1,000% increase in the use of ghost guns. So I understand the statistical problem, given that it's not actually something that is tracked by law enforcement on this side of the border as much, or by Statistics Canada. Is this something that is part moving forward that you would like to study or quantify? Because it appears to be an increasing problem, but obviously not something, as you point out, it's something we have to catch up on.
I mean, it's definitely something I would like to look at. Unfortunately, right now, the data doesn't exist.
Okay. You referenced gang violence. I know you've provided recommendations on anti-gang strategies, which has been really important. Do you see a link between the use of ghost guns and gang violence, and though I understand you can't quantify that this is something that should be of increasing concern to all of us who are looking at public safety?
Anecdotally, it is. The rates have increased, and of course, as measures are taken to restrict firearms ownership, there will be a black market that exists, and we're starting to see that these things being printed. Also, 3D printers are becoming a lot more common across North America as well. So it's one of those things where you're going to start needing to target the demand side of the equation. You're trying to control the supply side right now by banning firearms based on spurious definitions. And really, if you don't start targeting the demand side, you're not going to see any benefit. You're targeting usually legal gun owners who are going to comply with the regulations. They're the most likely to be involved in criminal activity in this country. They've already gone through screening. And so it's no wonder that when I look at these legislations, I don't see any benefit, because you wouldn't expect to get any marginal benefit on a group that is already such a low risk. That's probably where you should start directing your work, is towards the demand side.
Yeah. So given that, you have recommendations that you would make to this committee on the demand side, and specifically understanding the difficulty in quantifying the extent of the ghost gun problem, how, as a committee, we should be looking at that issue as well.
Well, the difficulty is, for a lot of criminals, they just need the gun for one purpose at one time, and then they can throw it away. And so even a printed polycarbonate barrel, one use, and then it's done. So the recommendations I would give you would be to start targeting youth at risk, very early at risk, so that are starting to get involved in criminal activity, and start youth diversion programs, diverting them away from that activity. Cognitive behavioral therapy, starting to work on the significant methamphetamine problem that we're seeing in all our communities across this country. Currently, my emergency department right now behind me is full of patients that are intoxicated or suffering from psychosis from methamphetamine abuse. I think that really this focus on a small segment of society that uses firearms for generally a legitimate purpose is maybe diverting your attention from a significant need right now, which is to start looking at diversion right away and funding those areas. There was, like I said, a 2012 report by
Thank you, Doctor. I'm going to have to cut you off there.
No problem.
Now,
Dr. Langmann, sort of similar question. Are you seeing evidence that it's new models of firearms being manufactured by firearms companies for the purpose of circumventing Canadian law? Are these being used in crimes? Is this something that is truly an issue?
Well, criminals will use any firearm they can obtain. There's not a firearm specifically they're looking for, mostly handguns, but they will use whatever they can get. The SKS as was brought up earlier. It's a firearm that's been around since the 1940s, and it's commonly used. It was very cheap and sold broadly in this country after the collapse of the Soviet bloc. So we've seen a lot of those being used because they're widely available, but it's just due to a commonality reason. So something that is common is used. All types of firearms are extremely dangerous. So the bolt action rifle, what we're calling hunting rifles, those have been used to kill police officers. Those have been used to kill patients that I've seen. They're extremely dangerous. They're more dangerous, I think, than what's commonly called an assault rifle, because the caliber and the energy from the projectile is a lot higher than most, quote, assault rifles like the AR-15.
So maybe a minute and a half or so with Dr. Langmann. Thank you for your work, and I think you have a long history of careful work on this. I just wanted to know what your confidence is in the data, because I've also heard that there's actually a lack of data. We really don't have enough data to be able to correlate the association between particular firearms and whether legal or illegally acquired, for example, and incidents. And I'm also worried about the perception that what we've achieved so far with gun control as one aspect of prevention of gun violence, that maybe we've gone too far. So I just want to know how confident you are in the amount of data we have, and if you believe that we should have more data to be able to really understand what's going on.
So you're asking someone who's a statistician if they'd like more data, and the answer is yes. We always like more data. The good thing is that actually there are a very low number of mass homicides in this country, and so that alone speaks to something. Partly it's a population issue. But however, I do, in terms of analyzing the data, sensitivity tests, it's called, to see how good is the data at predicting something. And the answer is it's actually fairly good at predicting whether, say, for instance, a certain legislation has had any beneficial effect. So in terms of homicide and spousal homicide and mass homicide, suicide, et cetera, I can say that. I would love to have, of course, data regarding where the guns were obtained, how specifically they were used, as well as the background of the perpetrator in terms of whether they have criminal background, whether this was used in a familicide, those sorts of things. Unfortunately, a lot of that data is also private and protected, so Statistics Canada has certain controls in terms of keeping that information. But that would be something for the government to, of course, mandate and work on.
Chair, I'll go to Dr. Langmann. Doctor, the government tries to convince Canadian and the Canadian public that they employ evidence-based decision-making. But based on your testimony and extensive, credible, non-government funded research, there's no evidence to support that firearm prohibitions have any impact on public safety, homicides, or suicides. So it seems to me the government is rather involved in decision-based evidence-making. So I think the committee really has to ask itself, would we rather have less firearms as they're proposing in our community, or would we rather have less criminals committing crimes with illegal firearms? And I mean, I will say that it seems to me that the lazy approach is to just outlaw firearms as they're trying to do. But your research, in your research, this would have a corresponding effect, you say, in nothing to do with ending gun violence, ending homicides, mass homicides, suicides, domestic violence. In the time that's left, can you please explain your thoughts on that, please?
Sure. I mean, the current proposals even confuse me because they're talking about assault weapons, and in terms of research, it's really hard to know what even that means. Because in my mind, they're probably talking about semi-automatic rifles. And so if you look at all the research, both that I've done and in other countries, actually, so Australia did ban majority of these, as well as Great Britain, and there's no evidence that it's reduced the homicide rates there. The fact is that people can still use other types of firearms, so bolt-action rifles. Derek Bird in 2010 drove around Great Britain with a shotgun and a bolt-action rifle and killed 12 people. So it's possible to commit these acts with any type of gun. What the legislation seems to do is it targets the sort of legal gun owners, and it doesn't seem to target. It did in terms of some of the mandatory minimums, but for the most part, it seems to target legal firearms owners with a variety of legislation and restrictions. And you're targeting a group of people that are rarely involved in criminal behavior. And so it would seem to me that your best target would be trying to reduce demand in the criminal area, trying to reduce the movement of young, usually male youths into gang behavior, and trying to deal with some of the proliferation of street drugs that have occurred in this country. We're at a dangerous level in terms of methamphetamines now. This is what I see in the emergency department all the time. And all I hear is we're targeting a bunch of hunters. It doesn't make any sense to me. It seems like we have our blinders on almost to what's going on around us. And I could go on, but I think that's... Please do.
I have a minute left. The floor is yours.
Very well. I mean, just to go back to this assault weapon, no, it's no wonder to me that we have this strange list, and we have some guns in it, some not, and it doesn't seem to make sense to anybody, and it doesn't make sense to me as a researcher, because to me it would be based on, you know, the action of the actual rifle. So is it a semi-automatic rifle? Is it a bolt action rifle that we're concerned with? And then are we concerned with the fact that most hunting rifles actually use high caliber, high velocity, high energy projectiles that can cause serious damage, and yet we're talking about those as if they're not a concern, and yet these sort of assault rifles like an AR-15 that uses a small caliber is somehow our big concern. You need a better definition if you're going to do anything, and if your definition is does semi-automatic rifle bans result in reduction in homicide, the answer is no. No, there's no good research that shows that from the United States, from Australia, from this country. So choose something else.